What you'll find is that companies have been trying to figure out the healthcare thing because they make hammers, they make engines, they make tubes. This is what companies do. They don't want to know anything about healthcare. But unfortunately, they've been thrust into this world where their costs are going up. It is now the second biggest line item in their company's budget. And they're like, what am I going to do about this? This is costing me more than payroll. It's costing me more than my material to run my company. I have to get involved. So what has happened over the last 20, 30 years is some companies have actually made a big deal about, I'm going to try to solve this on my own. The hospital systems aren't solving this for me. My broker's not solving this for me. I'm going to take it upon myself to solve this for myself. And so what they do is they start contacting independent clinics, independent organizations saying, what will you give me a colonoscopy for? What will you give me this surgery for? What will you give me this for? And they start working out these deals direct to employer. It's a specialty service direct to employer. And the biggest example of this in Wisconsin is Quad Graphics. They were the early innovator on this and trying to do direct to employer contracts with specialist services. And it has been mildly successful. But this has been going on now for 25 years, and it always just never seems to get off the ground. And it's understandable why it never gets off the ground. Because employers make hammers. They make tubes. They don't want to be writing checks for x-rays and labs. They want to get back to doing their business. So this is kind of the big revelation for me is I realized patients don't want their company telling them where to go to get a knee surgery. They don't want their company telling them where to go for, their gallbladder surgery. They want their doctor telling them where to go. That's where the trust thing happens. Is they want the doctor saying, hey, my company has this option. What do you think about it? Is this a trustworthy operation? I mean, are these doctors good? They want your stamp of approval. They want you to say, hey, yeah, this is a good thing, or no, this is not a good thing. I would not go anywhere near that. That's what they want. So it's that trust factor between patient and their primary care doctor. So I said, okay, that's the key here. Get the trustworthy doctor embedded in the company. Now the patient comes through you. Now the company doesn't have to worry about making those referrals anymore. Now the doctor that they hired for their company does that. And I say, yeah, this Renovo Health thing is fantastic. It's like, I can tell you right now that the people that are working out of that ASC are ex-big hospital system that got frustrated and they can't take it anymore, and now they're looking to have a decent life now too. And so guess what? Those are oftentimes the best doctors. They're the best physicians. And they've broken off now, and they're trying to find places like Josh and Steve where they can work and they can, get things done and actually have a real relationship with the patient. So the frustrations that I've come across with employers are A, human resources just doesn't want to make any change because they don't want headaches. The brokers are disincentivized to do the right thing. It really takes a special broker to do this. And C would be these direct-to-employer arrangements can oftentimes just never really get off the ground because there's just nobody guiding the care. There's nobody guiding people here, nobody guiding people there. That's where we come in.
To the role of primary care again.
Yeah. Under an independent model, not under the Death Star.
Yes. Very good.